Bangladesh has 164 million of population at this moment. Among them, about 7 million of population suffering from diabetes mellitus. On an average, 10% of the diabetes mellitus patients suffering from diabetic retinopathy. Diabetic retinopathy is the disease of the posterior segment of the eye where there is microvascular occlusion which causes leakage of fluid from the vessels into the retina. As a result, the patient becomes blind. There are so many scientific papers published in the world which shows us that if we diagnose this diabetic retinopathy early, these can prevent the loss of blindness in about 95% cases. In Bangladesh, there are about 53,000 medical graduates and 1,000 ophthalmologists. It is possible for the ophthalmologist in Bangladesh to detect all the cases of diabetic retinopathy. Then who will detect this diabetic? This is a huge burden. This diabetic retinopathy will be detected by the all medical graduate. Now how these 53,000 medical graduates will detect diabetic retinopathy without any proper tools? To detect this diabetic retinopathy by all medical graduates, we need low-cost tools. For long years, we are using this direct ophthalmoscope. These are good equipment, undoubtedly, but this has 3 disadvantages. Number 1, this is costly. Number 2, it needs battery. Number 3, we can't document what we are seeing in the retina. Dr. Richard, Medical Director of Fred Hollows Foundation, Australia, has given me this equipment known as Arclight. Can you see? This is the Arclight, which is ultra low cost. If we purchase this equipment in bulk, the price of this equipment is only $7.5. That means 600 Bangladeshi taka. There are 3 things in one equipment. Number 1, we can see the retina. Number 2, I can see the external and middle ear with this otoscope. Now this has become otoscope. This is otoscope. I can see the external ear. I can use these equipments as a lobe to see the external eye. Just to see the external eye, I can use this as a lobe. So there is 3 equipments. Number 1, this is a ophthalmoscope. Number 2, this is an otoscope. Number 3, this is an external lobe to see the external eye. This is the lobe by which I can see the external eye. By this Arclight, we can use to detect the retina, diabetic retinopathy. The best advantage of this equipment is there is a solar panel. I can charge this with the solar light. If I keep this in the sun ray for 3 hours, I can use it for whole day optionally. Or I can charge it in the bulb, near the bulb. Or I can charge this with the USB port for 20 minutes. Then I can use it for whole day occasionally. So it is economic. There is a bright free light. By this I can see the cornea with the fluorescent stream. And there are so many other things. This is the scale, this is the red scale, and this is the clip can keep this here. There is no chance for losing it, and everybody can use it. And for documentation, I can just document the retinal images with the smartphone. Just the alignment of the camera hole with the sight hole of this equipment. And then I can take this photograph of the retina and I can document it. So, for the medical student, for the medical graduate, can use it to detect the diabetic retinopathy. And by this way, I can decrease the loss of vision in Bangladesh for those who are suffering from diabetic retinopathy.
What are the problems if diabetic retinopathy is not early diagnosed?
If we do not diagnose the retinopathy early, this will progress to proliferative diabetic retinopathy, and this will go to the VTDR, that is visually threatening diabetic retinopathy, and ultimately retinal detachment and loss of vision. Patient will blind.
Is there any difficulty to see the conducts?
With this Arclight? Yes. For long years we are using this direct ophthalmoscope, and this direct ophthalmoscope has traditional bulb, but here this is the LED bulb. LED bulb is white. When you will see first time the fundus, you will see all the things are white. So that is a little bit difference. So it will take some time to become accustomed with this Arclight LED.
Have you any plan to introduce this instrument in medical education programs?
Yes, and this is the plan of the Federalist Foundation, because we are developing countries. Federalist Foundation is doing this diabetic retinopathy program in Bangladesh with the help of the Queen Elizabeth Jubilee Trust, and they will introduce in the medical program. And if our medical students become trained with this equipment with the low cost, and that will help us in future to build up.
That is looking for a cut.
Yes, definitely.
What are the advantages using Arclight over the traditional ophthalmoscope?
There are many advantages using this Arclight over the traditional ophthalmoscope. This is traditional ophthalmoscope is very costly. It needs battery. I can't document this, but this Arclight is cheaper. This is the solar panel. I can charge it in the sunlight. I can charge it in the bulb. I can charge it in the rescue board for 20 minutes, and I can use it for one day occasionally. And I can document this with the smartphone. And this is the advantage of this Arclight over the direct ophthalmoscope. Okay, thank you very much.
Thank you.
Thank you.